Thank you, Dr. Neha Kakkar and Dr. Rajneesh Kumar Sharma, sir. Good evening, good afternoon, and good morning. This is the 1652nd day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. Gauri Shankar. Let us begin the session with 1 minute silent prayer. Thank you all. The International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and doctors. We have 3 sessions every day. The first session of the day is already over in Hindi from 7:30 to 8:30, and we have the international session in English from 8:30 to 9:30. From 9:30 to 10:30, we have a local language session in Malayalam. We are uploading the videos of the same on the very next day itself. Unfortunately, due to a ban from YouTube, due to a session from us about the vaccination, they disagreed to our presenter, and due to that, we are not able to upload our videos for some more days, as there is a ban from YouTube. So please take note of this, so that if you want to listen or want to attend the sessions, you regularly attend the sessions, so that you will not miss the sessions. Anyway, let me come to today's guest. As you all know, it is Dr. Gauri Shankar. He is a classical homeopath, and he is a person who has made a presentation, some presentations here, some days back, some months back, I think. And he is a person always coming up with organon philosophy, like that. And today, Doctor will be talking about approach to a case through homeopathy. And he has completed B.H.M.S, NHMC, Lucknow, and he has completed S.C.P.H from Mumbai. He is an Ex.S.H.R.F, CCRH, New Delhi, Government of India, and is a founder of S.H.A. Samartha Homeopathic Academic Program, Lucknow. He is a national as well as an international speaker, and he has delivered so many lectures in different parts of India and other part of the world also. And he has an experience of more than 20 years in clinical field. And today he will be presenting a paper on homeopathic approach to a case. Let us proudly welcome the guest of the day, Dr. Gauri Shankar. Yes, Dr. Gauri Shankar has joined. Yes.
Good evening, sir. Good evening to all of you.
Yes,
Thank you so much, Dr. Dinesh, and thank you so much, every homeopathic doctor and friends, because for inviting me for this wonderful class. Okay, sir. Thank you. It's the clinic time, so there's some patient, but now I'm free. So thank you so much, sir, because this type of class and this type of series of homeopathic lecture is seriously is a blessing of Master Hahnemann. Okay, we are going towards the perfect knowledge of Master Hahnemann. So myself, Dr. Gauri Shankar, I'm from Lucknow, sir. Today I'm going to discuss with you the most important aspect of homeopathic is the approach to a case, because it's the most important part. It's the most important thing that we should know each and every step and each and every approach of cases of the diseases, because Master Hahnemann during organon, Master Hahnemann gave clear instructions to each and every case. So how to combat, how to cure, how to go through the cases, what will be the approach. Today we are going to discuss each and everything with confirmation of organon of medicine, right, sir? So let's go ahead. Thank you so much, sir. Thank you so much to everyone. Let's go ahead with the case. with the discussion, with the slide. So can I share my slide? Can you give me access for sharing my slide?
Yes, since you are a co-host, you can do it.
Okay, thank you so much.
Approach, please. Yes, you can
Okay,
go
sir.
ahead.
Thank you so much, sir. This is so as we know, this is our duty, sir. The physician high and only mission is to restore the sick, to help to cure at his term. That means it's our mission to restore the sick. But how we restore the sick? And 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 how we restore the sick in the fastest way. And this is the most important aspect of homeopathic doctor. And we should know how to cure, in the fastest way, as Master Hahnemann says in Ephraim number 2, the highest ideal of cure is rapid, gentle. Then how we go rapid cure? That means Master Hahnemann clearly said in aphorism 3, and this is one of the best aphorism, and we should know each and every aspect of this aphorism. What Master Hahnemann trying to convince us, before going to cure, before going to the process of giving remedy, we should know about the disease first. Once we know about the diseases, once we know about the patient ailment, then we go comfortably which approach is one of the surest approach to the case before us. Then the first and most important line, sir, if the physician clearly perceive what is to be cured in diseases. And this line is simple identity of homeopathy, sir. The concept of disease and concept of understanding of disease is totally different when we go through homeopathic aspect. Homeopathic understanding of disease is a totally different story. It's not as much as simple like allopathy. Then we understand patient as a whole at the level of mind, body, at the level of spiritual level, at the level of behavior. And every disease in homeopathic case, every disease reflect in behavior, reflect in emotion also, as well as on pathology. The with as per the pathology, with the reflection of that pathology at the level of mind and body. That's why Master Hahnemann says, if the physician clearly perceived what is to be cured in diseases, that is to say, in every individual case of disease, sir, individual case of disease, every case, every individual is different. Then we have to prove that individual case individually. So first, going to the approach of disease, we should know which type of diseases as a homeopath we are going to deal. The first, we should know then the classification of disease is the most important part. Once you know the classification, then according to this classification, Master Hahnemann time to time give clear instructions how we cure acute diseases, what will be the approach of curing acute diseases, how we understand chronic diseases, what are the conditions that proceed the patient into chronic pathology, and what will be the ideal way of cure, ideal approach of cure for chronic disease, like a miasmatic aspect, anti-miasmatic, anti-soric, anti-psychotic, and anti-syphilitic. How we go through this? Then what, homeopathy, in case of homeopathy, we are dealing with 5 types of cases. One is acute diseases, second is chronic and acute manifestation of chronic diseases, artificial chronic diseases, pseudo chronic diseases, indisposition, and every classification, every condition have unique way as per Master Hahnemann. Time to time in aphorism, Master Hahnemann give clear instructions. So what we know before going to approach the case? Disease or nature of disease. Chronic, acute, artificial chronic, pseudo-chronic, mental, one-sided. And same thing, Master Hahnemann says in aphorism 245. And this is the one of the best aphorism, because this aphorism is simple, called SOP of cure. If you want to cure the patient, then what will be the approach as per Master Hahnemann? Collective approach for curing a disease. The collective approach is what? There's the five step and 5 necessary things that we must know before going to cure the patient. Yeah, during, before, after, you know, these 5 types. One, Master Hahnemann says, to chief, you have to understand the chief variety of diseases. You know, chief variety of diseases. That means you must know which type of pathology you are going to deal. You must know you are going to deal with SORA, you are going to deal with psychosis, syphilis, or pseudo-chronic disease, artificial chronic disease, acute diseases, acute pandemic, acute epidemic, acute individual. So we must know the clear-cut difference, clear-cut understanding, and each and every disease. Like if we want to go, to cure the acute diseases, then acute individual. Master Hahnemann gave a clear approach how to cure acute individual diseases in aphorism 73. Then we must know. Then second is two peculiar circumstances connected with them. Means, what are the peculiar circumstances connected to your present pathology? Peculiar circumstances means how we complete the symptom. Simple. Circumstances means aggravating and ameliorating factor. That means pathology plus peculiar circumstances connected with them. Means what will be the causation? That causation is peculiar circumstances that will create that particular pathology. जैसा कि पेशेंट आपके सामने आया है, जो पैथोलॉजी लेके आया है, then you must know. Then we must know the location, and location is called peculiar circumstances. Modality, aggravating factor, ameliorating factor, concomitant, these things are what? Peculiar circumstances. And this peculiar circumstances is very, very connected to the pathology, and वैसा ही connection, same connection we find in remedy. Similar vascular. Then after, mode of employing of them. If you are employing remedy, if you are employing medicine, then what will be the mode of employing? Then after remedy, the last and final thing that will complete our approach to a particular case is what, sir? The diet and regimen to be observed during their use. वो जो remedy we are using, that remedy, उस remedy के use के पूरे duration में, and the whole duration, we must regulate the diet and regimen. So 245 is simple SOP of cure, but how we go through? Simple. Then we have to understand the disease and the manifestation of the disease. Symptom. Then we must know the symptom, and every symptom are not, मैं कहता है कि कोई भी symptom ऐसे नहीं आता. There's no haphazard manner of symptom in your clinical practice. Simple. Just go to this slide. Master Hahnemann says कि no mental or physical activity, no mental or physical symptoms, activity, behavior is random or meaningless. Try to understand this. If you understand this line, then everything is based on some definite cause. Master Hahnemann clearly says in aphorism 5 and aphorism 189, everything, either acute, chronic, pseudochronic, every disease or every behavior, every physical, mental behavior, this is what? Simple. This is what? A behavior, a cell behavior, simple, a particular mental behavior, particular physical behavior. That behavior, if that behavior is not up to the normal, up to the standard mark, that behavior automatically convert into the symptoms. That means this behavior is not good, it's not up to date. That means this behavior is converted to symptom. Then once we are going through the symptoms, then symptoms are not random. Symptoms are not meaningless. All the mental and physical activity are meaningful. Try to understand this line. All the mental and physical activity are meaningful, purposeful, and connected with the previous life experiences, good or bad. And all these things are defense to stimuli, and these are genetically determined. Then you should know, before going to the remedy, before going to deciding what remedy we are going to give this particular patient, you should know each and every minuteness of the symptoms, each and every peculiar circumstances of a particular patient. Then you must know. So everything, these lines are wonderful lines, guys. You have to understand, you have to perceive this line, and you have to find all these understanding in your patient before giving the remedy. So everything from thinking pattern to emotion, from look to expression, to the disease presentation, all are the representation of the gene. Because in homeopathy, what we are aphorism 1, the physician having only mission to restore the sick. We are going to deal the sick, and sick is what? Simple, a manifestation of gene. Then everything is governed by our vital force. And the defense. So हमें क्या जानना है? So also it will depend upon an underlying fundamental defense process. Then disease is simple, a type of defense process. So in order to make genetic based prescription, if you want to give a prescription approach, then we must know we must understand the presentation of gene in the human body, and this can be done if we follow a specific pattern. याद रखिएगा, अब यहां से आप प्रैक्टिकल अप्रोच में जा रहे हो, राइट सर? So this can only be done if you follow a specific pattern and the system of the questionnaire in every case of diseases. तो आपको स्पेसिफिक पैटर्न समझना है, right? So this will be the pattern of a common pattern of each and every case. This will be the common pattern. This is called simple a way of prescription, the approach of prescription. The approach should be different, but this thing is same, is a common to each and every cases. Either we are dealing with acute or dealing with chronic, artificial chronic, whatever we are going to deal, this SOP will be same. ऐसे कहावत है, कहते हैं लोग कि two homeopathic doctors are not able to give two same remedy. Why? भाई तो कहते हैं दो डॉक्टर एक ही बीमारी में दो अलग अलग दवाई निकालते हैं, ऐसा लोग कहते हैं. वो अलग है, वो रेमेडी अलग निकल सकती है, आपका अप्रोच सेम होना चाहिए. रेमेडी विल बी डिफरेंट एज पर द डिस्पोजिशन ऑफ द पेशेंट. If patient disposition is angry, if patient disposition is mild, malicious, then this will be the final disposition, will be the final choice of the remedy. And this disposition is the identity of homeopathy. But SOP should be same. If our SOP should be same, then although we prescribe different remedy, but the SOP should be same. And once SOP is same, then result will be the constant. आपका रिजल्ट बिल्कुल परफेक्ट होगा, भले ही आपकी SOP चेंज हो जाए. Then what will be the ideal SOP of a homeopathic prescription of a homeopathic physician? Simple, sir. We should follow 3 steps only. If you follow these 3 steps, then we are able to cure conformably to the nature. The first step is what? हर case में, each and every case, we should follow these 3 steps. First step is what? The pathology. We should know the pathology. Pathology means what? Manifestation of disease. Pathology in homeopathy, how we decide this patient is going to be this patient is this type of patient. Simple, with a perfect understanding of pathology. As Master Hahnemann says in Aphorism 2, if the physician clearly perceives what is to be cured in diseases, this is simple. We must know the manifestation of disease through the symptoms, then symptomatology. And this first step of SOP is common. And you should know, we should take the proper case. Then understanding of pathology, ये बिल्कुल तब तक आप नहीं कर पाओगे जब तक आपने प्रॉपर केस नहीं लिया. इफ यू नॉट टेकिंग प्रॉपर केस, यू आर नॉट able to understand the pathology in homeopathic sense and manifestation of disease. Once we understand the pathology, then we should find the ailment. Ailment means what will be the foundation. At what foundation this pathology come in existence? What will be the foundation of that perfect pathology? Then that foundation is called ailment, and that ailment is called simple cause. Infrequently we encounter with the patient ailment from this, ailment from that, ailment from being exposed in cold air, ailment from mortification, ailment from anger, ailment from suppressed anger, and from ambition deceive. You should know this second SOP. And this is one of the most powerful exercise, guys. We have to do each and every case. We have to do in each and every case. And third is disposition at the level of mind and body. Now, disposition means what? General disposition, mental disposition, physical disposition. Disposition means pravritti. And Master Hahnemann clearly says, let's go and let's show you what will be the power of disposition. Master Hahnemann clearly state in aphorism 211 to 213, if we are not matching the disposition of the patient, we are not able to cure the patient. Straightforward. Master Hahnemann clearly says. Let's show you this aphorism. What then pathology, that manifestation of disease, cause is based on aphorism 5. Fundamental cause याद करिए जब बोला कि अगर when we are going to cure the patient, then we must differentiate the case into 2 parts: acute cases and chronic cases. Then acute cases, behind acute cases there's a most probable exciting cause. We must probe it, we must find it, what will be the most probable exciting cause. Then if we are going to cure the chronic case, then we must know what will be the fundamental cause for that perfect that manifestation of the chronic miasm. Then you must know the fundamental cause, and the fundamental cause is due to depend upon the chronic miasm. Then you must know ailment. Then third one is disposition. We generally miss it. We as a homeopath, हमारा ध्यान ही नहीं जाता इस पे. हम disposition मैच ही नहीं करते. You are not matching disposition. If you are not matching disposition, you are not able to cure the patient as per homeopathy, as per homeopathy. And this disposition is the one of the most important factor why we fail. You know, कभी कभी ऐसा लगता है रेमेडी भी परफेक्ट है, टोटलिटी भी मैच किया, पोटेंसी भी बिल्कुल सही दी, फिर भी रेमेडी ने काम नहीं किया. The remedy is not perfect, remedy is not up to the mark, remedy is not working. Then what will be the reason behind this? The only reason, we are not perfectly match the disposition of the patient with the disposition of the remedy. Okay? So let's understand what Master Hahnemann says clearly in aphorism 2 to 3. I am going to show you to the aphorism. Very clear, very clear instructions. Let's go ahead. Give me a minute. During mental diseases, during mental diseases, Master Hahnemann clearly gives some aphorism. Just have a look, guys. 211. Have a look. Aphorism number 211. These are the most powerful line given by Master Hahnemann. Most powerful line. And we must ignore this line in daily practice. इतनी जल्दी होती है दवाई देने के लिए, मैच किया, दवाई दे दिया, डिस्पोजिशन नहीं मैच करेंगे ना, तो देखिए कंसिक्वेंस क्या होते हैं. मास्टर हनीमैन क्लियरली गिव एग्जांपल इन फुटनोट नंबर 211. जस्ट गो अहेड. देखिए क्या लिखते हैं. दिस होल्ड गुड टू सच एन एक्सटेंट दैट द स्टेट of the disposition of the patient. Line देखिए ना सर. Just feel this line. Master Hahnemann are so meticulous in their writing. They never do mistake, and Germans are so meticulous, you know. Germans never do mistake. Each and every line of Germans are, मतलब उसको ना बहुत अच्छे से तौल के बोलते हैं. तो कहते हैं this to such an extent that the state of disposition of the patient often chiefly determine the selection of the homeopathic remedy. ये लाइन देखिए सर आप लोग. Just have a look. What chiefly determines the selection of the homeopathic remedy. Just have a look. Not only chiefly determine, as being a decidedly characteristic symptom. It's not only chiefly determined, but what? Decidedly characteristic symptom, which can least all remain concealed from the accurately observing physician. बोला chiefly determined. Just go ahead, sir. फिर बोलते हैं 112 aphorism 212 कहते हैं the creator of the therapeutic agent has also had a particular regard to this main feeling. What main feeling, sir? The disposition. That means what will be the general mental, physical, spiritual behavior during the pathology is the main feature. Is the main feature of all diseases. All जो भी बीमारी आपके पास है, either acute, chronic, pseudo-chronic, artificial chronic, whatever diseases you are going to deal, during the disease condition, what will be the disposition, and the disposition will be the main feature of all disease. And what is disposition? Not the altered state of disposition, altered state of disposition of mind. और देखिए, so summarize करके मास्टर ने summarize all above aphorism and give a perfect aphorism for disposition is what? 213. So we shall therefore, लाइन देखिएगा सर, मास्टर हनीमैन की लाइन है ये, और ऑर्गेनन में सब कुछ है, एवरीथिंग यू फाइंड इन ऑर्गेनन, every tools, every medicine, everything that is necessary for the restoration of the health of the patient, everything is compiling in this short book called Organ of Medicine. So master has summarized, we shall therefore never be able, sir, never be able to cure conformably to the nature, never be able, sir. होता ना कभी कभी सब कुछ सही है, दवाई भी सही, पोटेंसी भी सही, सिलेक्शन भी सही, रिपीटिशन भी सही, everything is perfect, but disposition is not matching. We're not matching the disposition. Then you never be able to cure conformably to the nature. That is to say, homeopathically. If we do not, in every case of disease, either acute, chronic, pseudochronic, even such are as acute, along with the other symptom, देखो बोला, along with जो भी आपने symptom collect किया, along with the other symptom, you should match the disposition along with other symptom, though relating the change in the state of mind and disposition. अगर आप ऐसा करते हो तो, और इसको बहुत अच्छे से एग्जाम्पल देके बोला है, इन्होंने एग्जाम्पल भी दिया, मास्टर गिव क्लियर एग्जाम्पल, and you must know this example. This example is the clear cut indication how disposition are important and why disposition are important. So thus disposition, thus aconite, very frequently we are giving aconite in acute cases. But if the disposition of aconite not matching, you are not conformably to the nature, you are not going to cure. You may suppress, palliate, remove symptom for some days, but you're not able to cure. You are not able to cure conformably with the nature if you're not matching the disposition of the patient. So aconite will seldom, sir, a master Hahnemann की line है, aconite will seldom or never effect. Seldom or never effect. Aconite will never give perfect effect. Which type of effect, sir? Rapid or permanent cure. ये masters के line है, sir. All these lines are written by master only, written by Dr. Hahnemann only. What, sir? Aconite will never effect a rapid or permanent cure in a patient of a quite calm, equable disposition. Means what, sir? If a patient is calm, cool, although he's suffering from acute diseases, although everything is matchable, जैसा किताबों में लिखा होता, ठंडी हवाएं, all these things, unquenchable thirst, everything. But the disposition, behavior of the patient is quiet, calm, equable. Your nux vomica, your aconite should never give a permanent cure. So what is the disposition of aconite? Can anyone? Disposition of aconite is what? Tension is a keynote of aconite. Anxiety is a keynote of aconite. Restlessness is the keynote of aconite. ऐसा बोलते हैं ना? The first line of Allen's keynotes, anxiety is a keynote of aconite, right? And here, if your patient is quiet, calm, equable, there's no anxious, no tension, the aconite will never work. And you blame, everything is, हर चीज तो मिलाया हमने, हमारी दवाई काम नहीं करती. वो काम करती है तो ऐसे काम करती है, फिर ये गड़बड़ हो गया सब। वैसे ही similarly sir, and just as little will nux vomica be serviceable. जैसे एकोनाइट ने थोड़ा बहुत काम किया, सिमिलरली nux vomica will will be serviceable where the disposition, ये लाइन देखिए जरा आप लोग, सारा खेल किसका है सर? डिस्पोजिशन का है। बोला where the disposition of nux vomica is mild and phlegmatic. What is the ideal disposition? कहते ना formula, homeopathy having some formula कि nux vomica should given in night and sulfur should given in morning. ठीक है, it's good, it's okay, you should give nux vomica in night. But if the disposition of nux vomica is not matching, आप नाइट में दो सर, मॉर्निंग में दो, पृथ्वी पे दो, चंद्रमा पे दो, nux vomica will not serviceable in a perfect, rapid, gentle, permanent cure. काम ही नहीं करेगा सर। और देखिए, pulsate level, if the patient is happy, gay, and ignitia, it is imperturbable and disposed neither to be frightened and vexed. If you're giving ignitia, if a patient not vexed, not frightened, your ignitia will not work. So disposition is the most important part. That's why I am giving you some formula regarding SOP of cure, and this will be the formula. What's it? This 3, ये 3 formula आज लेके जाओ सर आप. This will be the concept of the day, sir. This will be your concept of the day. What, sir? In each and every case, we go through pathology. Simple pathology means manifestation of disease, number 1. Then what will be the underlying cause of that manifestation of disease, and the disposition of mind and body. ठीक है? ठीक है सर, चलिए, let's go to the next slide. So approach, if the case is acute, then what will be the Master Hahnemann approach of that acute case? Then first you know the clear-cut classification of that acute diseases. So how many type of acute diseases in homeopathy we are going to deal? There are 5 type of acute diseases, and each and every step, each and every type of acute diseases having a different concept. If we are going to deal with indisposition, this is a type of acute diseases, and indisposition are a total different story. Master Hahnemann, in their writing, in their aphorism number 150, give how to cure, what will be the approach of indisposition. Then acute can be divided into 2 types, individual acute diseases and acute diseases जो एक community को affect करता है. The individual acute disease, 73 aphorism. If acute disease connected to the group, then group भी 3 type पे हो जाएगा, epidemic, pandemic, sporadic, and each and every type having different approaches. So let's go. So understand. Aphorism 5, first part. Useful to the physician in assisting him to cure are the particulars of the most probable exciting cause of the acute diseases, guys. Acute disease. You know what? We must probe. We must probe the most probable exciting cause of the acute diseases. Most probable exciting cause, sir. And what will be the most probable exciting cause? If you're able to understand, if you're able to find in the acute diseases, are they either of such a kind that attack individually, are exciting cause, being injurious influence, वो क्या क्या हो सकता है? देखिए, these are the points where we go and understand and find what will be the most probable exciting cause. Then excess of food. You find if there is excessive food, and this excess of food with the reason for the acute diseases, or insufficient supply of it, severe physical impression, chill, overeating, all these things may be the most probable exciting cause. You must know, you should know. Then in reality, what is the concept behind acute diseases and what is acute diseases? They are generally only a transient expulsion of the latent SORA. Then acute disease is simple, a transient expulsion. मतलब transient expulsion of the latent SORA, which spontaneously return into a dormant state if the acute disease were not of too violent a character and were soon quit. ये भी कहा कि अपने आप शांत हो जाता है, automatically return if the cause is not so severe. That means here miasm not transform into that latent miasm is not transformed into developed miasm. So ये भी एक अलग कहानी है सर. This is altogether different story. How are miasm transformed? How that latent miasm, latent SORA transform into developed SORA. There's three term. जैसे हम लोग हमेशा फर्स्ट ईयर सेकेंड ईयर से सुनते आते थे, बहुत कंफ्यूजन होता था. What sir? Latent SORA, SORA proper, developed SORA, pseudo SORA. Latent SORA, developed SORA, SORA proper, dormant SORA, developed SORA. ऐसे करके सुना है बहुत सा. And each every words having their own story. When we call latent SORA, when the SORA is called developed SORA, when that SORA is called a SORA proper and the pseudo SORA. So ये सब के पीछे अपनी अलग अलग कहानी है और उसका अप्रोच भी अलग अलग है. Once we going to understand this approach, right? So we'll discuss that approach कभी और. So what will be the approach? Simple. Acute exhibition of chronic diseases. Sometime patient come to us. At first sight, when we see the patient, look like acute diseases. But once we understand the symptom and go behind the symptom, then we understand, no, it's not acute diseases, it's an acute exhibition. It's acute exhibition of the chronic disease. That means chronic disease का acute manifestation है ये, और हम उसको acute की तरह ठीक करने निकल जाते हैं. Approach हमारा acute की तरह होता है. And this is not a right approach. Then we must know. We must know either this disease is acute or there is some reason behind this. Acute manifestation है कहते हैं ना कि वो, जैसे for example, a patient is suffering from severe allergy and severe rhinitis and severe cough, and we go through the patient, you look like there's a simple cold and cough. Once we go through the history, then you understand this patient is a confirmed patient of COPD. Now COPD is not too violent, but due to some exposure of pollen glands and acute exciting cause like cough, cold, the patient aggravated. Then the approach is different. So what we do in this type of cases, there is 7 and 8 step, and you should know each and every step very clearly. And these steps are simple are the step जैसा कि मैंने SOP में बताया पीछे, जैसा आई डिस्कस इन SOP, these 3 steps are the step of ailment. आपको दिखेगा ये 3 चीजों का कॉम्बिनेशन, दिस इज द कॉम्बिनेशन ऑफ दिस 3 थिंग्स. व्हाट इज pathology, ailment and disposition. These steps are the combination of this, of the step of disposition, ailment and home step. If the physician clearly perceives, that means you should identify the miasm or the pathology of the disease. Then second, you should know the journey of disease. Why in each and every case we should know the journey of disease? Because this is the most important part, guys. If you're not able to understand the journey of disease, you're not able to understand the patient is going cured, suppressed or palliate. You are not able to see the CAN 12 observation in your practice. You are not able to see the the Herring's law of cure in your practice. Right, sir? So just give me a minute, sir. So this will be the step. Let's go to the end of the slide. So this will be the way of prescription. Each and every day we are dealing with the patient. In our approach should decide if we are going to cure the patient, we are going to suppress the patient, we are going to palliate the patient. So these are the most commonly approach. The first approach is what, sir? The ideal drug picture. If finally when we are going towards the remedy, हम remedy देने जा रहे हैं, we are going to decide the practice, we are going to decide the remedy. Then the first approach is ideal drug picture. So during whole the, just give. Now this is the first and slow progressive psychotic cases. Slow progressive cases जिसमें patient having rheumatoid arthritis, psoriatic arthritis, diabetes, complications, hypertension. Then this is the simple step. You can take a screenshot or take a notes. Step the first, identify the miasm. That means we should know the cause. Then journey of disease. If there is underlying cause, recent, देखा ना, the cause, recent, relevant, कोई भी cause है जो recent हो, relevant हो, you should take the cause and find the syphilitic as well historic rubrics on the mind and disposition, give remedy according to this. Then a fast moving pathology है, इसका मैं एक केस दिखाऊंगा आपको अभी. If the fast moving fetal disease is out of control हो गया, then identify the miasm, cause, find the rubrics of the miasm of the mind and body, identify the general thermal thrust, physical and general expression, then repertorize and give remedy. So I'm going to show a simple case, a simple, taking a strong rubric, ideal drug picture, number 1. Second, taking a strong rubric, number 2, interpreting a peculiar behavior and converting that behavior into rubric. Number 4, combining a basic rubric and selecting as per totality. Group study या group remedy study के बेस पे आप prescription दे सकते हो. Element, pathology, disposition, strong miasm, PQR symptom and all. So I'm going to show you a case and how we're going to select the rubric of this case. Dr. Dinesh, can I show my case? So I'm going to show simple approach how we go. There's one case, a patient of I hope a patient having some problem with their rectal bleeding, and he's my car cleaner. So one day I got my car dirty. So I gave call simple. What happened, brother? Why are you not here? The patient says कि डॉक्टर साहब बहुत ब्लीडिंग हो रही है और मैं चलने में असमर्थ हूं. आई एम नॉट एबल टू स्टैंड. Then I call him, please come at my clinic. Patient come. Just look what with the condition of the patient at that time. Just have a look, guys. And what will be the approach? Sure. So this simple diagnosis is suspected rectal cancer. Patient is suffering too much pain, severe bleeding. वो ना गॉज और एक कपड़ा लगा के आया था मेरे पास. So just this. Just look कितना पेन होगा इसको. And doctor advise him to go with surgery. Just have a look. अब दिस इज सिंपल केस. इतना इंफॉर्मेशन हमारे पास है, इससे ज्यादा इंफॉर्मेशन हमारे पास नहीं है. सो व्हाट विल बी द अप्रोच, हाउ वी गो in this type of cases? We have no time. Patient are having severe bleeding, patient having severe pain. So I just show you that the way. So with the help of this chart, we are going to take a strong rubric and we are combining this rubric with the, we are differentiating this rubric with the disposition and give remedy as per the disposition of the patient. So what will be the rubric? Simple. आप जाओ repertory में, you should find this rubric. देखिए, in repertory we go, if you go then you find this rubric. Simple. If the physician clearly perceive what is to be cured in diseases, then what is simple is the hemorrhoids, protruding, prolapse, bleeding with. Simple. So हमें एक ऐसी रेमेडी देनी है. वी फाइंड अ रेमेडी हैविंग हेमरॉइड्स एंड दैट हेमरॉइड्स विद प्रोट्रूटेड या प्रोलैप्स ऑफ हेम. दिस इज सिंपल. प्रोलैप्स ऑफ रेक्टम, whatever the pathology. If this pathology is cancer, what it is, whatever, it doesn't matter. In homeopathy, we are not going to deal with diseases. We are going to deal with patient. Simple. बहुत सिंपल से अप्रोच रखना है आपको. वेरी सिंपल अप्रोच. And this two remedy, and which one is bleeder? Simple. Lachesis. And we prescribe that patient lachesis, and after prescribing lachesis, only 3 to 4 days, what will the condition of that patient? Just have a look.
Doctor, only just 3 minutes remaining.
Okay, sir. We'll combine. So guys, then after, this is the final condition of the patient. There's no sign of any prolapse. There's no sign of bleeding, and whether masses are reducing. There's no sign of any. Why? Because approach is most important factor in your practice. Approach. So thank you so much, sir, for giving time for this presentation. Now it's over to you, sir. You can ask if anyone asks some question.
Yes, Dr. Gauri Shankar, it's really an excellent session indeed, and we are very thankful for such a session. Unfortunately, we have no time for discussion. I invite Dr. Kalyan sir as Dr. Kalyan Swarup to say a few words on the presentation. Yes,
Okay,
sir.
sir. Hello.
Yes.
Yes, sir.
I am
Good
audible.
evening.
Yes.
Yes, sir. You're audible, sir. Thank you so much. Good evening.
Okay, sir. Nice presentation given by Dr. Gauri Shankar ji. Altogether, I think the maximum of the organal parts is covered by him. But one part is must be necessary to talk by the Gauri Shankar is knowledge of physician. Apron 3 is more important for the every homeopath.
Yes, sir. This is the most
You know,
important part.
most important part in the organ of the apron 3. Because if you know the knowledge of physician, altogether everything you find in this aphorism.
Yes, sir. This
Altogether,
aphorism is
Gauri Shankar is a nice presentation. And I want to say on what point of basis you prescribe lachesis?
sir, simple, sir. Just as we know, sir, Master Hariman clearly says once we are going to deal with one-sided diseases, sir. So one-sided disease having no clear-cut indication of the remedy, right, sir?
There
So-
must be indication of lachesis. Patient may be the talkative nature, maybe the suspicious nature.
At that time, sir, Master Hariman says, definitely, sir. Patient.
Sir, we can, since there is only a few minutes remaining, we can go ahead with another session later so that we can have question answer session with the, if the Gauri Shankar is, doctor is ready, we can fix a session on 15th of this month itself.
Definitely, sir, I'm also ready, sir. And
Okay.
each and every exercise as per ordinance, sir.
This
Master Hariman,
very good presentation in that way.
Dr. Kalyan, sir,
Yes, sir.
simple. I'm giving some positive information, sir. Go through the aphorism number 162, 163, 164, where master clearly indicate if there's a portion of the remedy should match, तो अगर वो पोर्शन मिल रहा है ना दवाई का सर, तो हमको बाकी सोचना नहीं है, वो तो हाइपोथेटिकल है सर, वो नहीं दिख रहा है तो क्यों दे? Status morbi is the most important part.
Yes, yes, we can have
Master
it.
Hariman clearly indicate in aphorism 189, status morbi.
So I invite Dr. Rambaresh sir to say a few words as well as vote of thanks to the session. No, vote of thanks will
Thank
be
you.
Mr. Abdul
Thank
Salam, sir.
you.
Okay.
Thank you, Dr. Dhanesh ji, and congratulations, Dr. Gauri Shankar, sir. Very nice presentation. Excellent session.
Thank you so
Very
much, sir. Thank you so much.
deep study of organ of medicine. Main cause of disease, approach, mental and physical. Disposition is a very good describe. Disposition. So time is short. So very thanks on behalf of IFPH whole team. Again presentation. Same
Always ready, sir.
second
Always
part
ready.
of presentation. So very thanks, sir. Men, thank you.
So it is up to Sri Abdul Salam sir to say vote of thanks to the session.
Okay, it's enough, Dr. Dhanesh. Hello, hi, Dr. Gauri Shankar.
Hello.
How are
Thank you so
you?
much, sir.
Welcome.
Thank
On
you.
behalf of IFPH, I would like to express my thanks to Dr. Gauri Shankar and all our well-wishers. Thank you.
Thank you, sir. Thank you so much. Thank you.
Okay, meet again.
Thank you all.
Thank you,
Tomorrow,
Dr. Dinesh.
possible. We will arrange another
Thank you,
session.
Dr. Ramprasad, Dr. Kalyan. Thank you so much.
Thank you very much.
Thank you, Dr. Gauri Shankar and others, those who attend the session. Tomorrow we will have a session from Dr. Kulwan Singh sir, and the subject will be rheumatic fever, heart, and its homeopathic management part 2. So hope all of you will be joining us tomorrow on the same time by using the same team, the same link. Thank you all. Good night.
Good night to all of you. Bye-bye, sir. Bye-bye. Thank you so much. Thank you.
It's over to Dr. Mariama John tomorrow in the Malayalam session.